But first, the doctor is in to combine traditional, functional, and holistic medicine with anti-aging and luxury. Listen, if you've been WebMDing your symptoms because it's hard to get into your doctor, or you feel like you just don't have the time, perhaps you've considered a concierge practice. So we wanted to do a deeper dive into what that actually means with Dr. Priya Patel, founder of Feminology MD. So they offer gynecology and well women's services and a ton more as well. Welcome, Dr. Patel.
Thank you for having me. I'm so excited to be here.
Okay, this is great. And I was actually at your facility. So you guys, I did some research and kind of went in to kind of experience it myself, see what it was like. I have to say, like, the best thing was that somebody came in and did a blood test while we were talking, and I was like, this woman is the most efficient woman I've ever met in my life. But talk about your practice, talk about what made you want to create this practice.
Yeah, so my background is I'm a traditionally trained OBGYN, and then I went back and did some additional functional medicine training in the last 2 years, and I just felt I loved my practice. I had a very, I was delivering babies and I was doing traditional gynecology as well, but I just felt like time was so limited. I felt like I never had enough time with my patients, especially when they were done childbearing or between children, and they really were focusing on sort of overall wellness, or they had traditional gynecology issues or hormone issues, and they just didn't feel great. And I felt like there was a lot of things that could be done, but there was never enough time. So that was sort of my motivation. I just kind of thought there has to be a better way, and so that's when I went back and decided to do the functional medicine training and sort of built my practice.
Yeah, I mean, you guys, it was so great because, I mean, I've been seeing doctors like nonstop for years and years and years and years, and it was like you were the first person that actually talked to me about my pumping schedule, for example, like making milk for the baby, and I thought, well, of course, and I have to say, like, we're up an extra couple ounces, and I think I'm sleeping a little bit more. So thank you for that. And it's true. It's because we had the extra time to kind of go over it, which was quite lovely. I would also like to hear a little bit why this integrative approach, why this additional education on your part, and how does it help the patients?
Yeah, no, absolutely. So, I mean, traditional medicine is, of course, invaluable, right? Yeah. That is sort of the root of all of medicine, and there's decades upon decades of research, and I think that's invaluable, right? That's never replaceable. But I think sometimes when you look at research trials and things like that, in order for sort of typical or traditional medicine to get updated, a lot of times textbooks are 1 or 2 decades behind the research. And so a lot of times I think in order for individuals or, kind of traditional doctors to sort of change their practice, or, it takes time, and oftentimes that can take years. So I think functional medicine is a little bit more of a different approach, right? The idea is to sort of not just say, oh, you have this problem and you need this medication, but also to really delve sort of into the root of things. And why are you having this problem? How do we sort of, not just treat the problem, but how do we actually fix the underlying problem? So you're sort of really looking at it's more of a root cause analysis to really kind of not just mask the problem, but actually fix the problem from the inside out.
I think that so many people are looking for that too, right? Like consumers, we're becoming more wise, we're becoming more educated, we're starting to look for that, and so now it's available with you in Dallas. What about, in terms of getting started, what does that look like for somebody?
Yeah, no, so absolutely. So typically, we'll typically start with the new patient consult, which is about an hour. Problems are often complex, right? And it's not always just a quick fix. So typically we start with a 1-hour visit. We'll really walk through everything, sort of determine what lab workup or other functional medicine testing might be appropriate. We'll usually do that same day in the office, try to make that process as efficient as possible. If there's any at-home testing required, that will go home with the patient the same day. And then we'll usually schedule another hour follow-up about 1 to 2 weeks later to go over all of the results. And then the idea is that, the patient really leaves that day with sort of a comprehensive plan in place.
Oh, so needed. I think so many of us are playing symptom whack-a-mole. Like what's this? And you're going to all these different people, and you're, like I said, WebMD, we're Googling it, we're looking it up. Okay, great. Dr. Patel, congratulations on everything. Thank you so much for coming in.
Thank you so much for having me.
Our pleasure. Okay, so it is Feminology MD in Dallas, and we will put all the information on our website, cw33.com.